Sorry about that. My nurse came in and uh, got in my way of taping. Anyways, um, so I got my stoma here, right? And what's happening with my stoma is that it's prolapsing. That means a prolapse means that the center of the stoma will come out like an accordion. And you see mine is a nice pink color, so it's still healthy. You know? It's still a healthy... Here, let me open this so you can see it better. Yeah. You see that? It's still a healthy stoma. Even though, if you could see that, it's how long it's getting. The center of it will be coming out. And if I'm walking around. So, what I did, I looked online and I found different ways to get rid of that problem. And one said that, if you put a cold compress on and put some pressure on it after it gets cold, with the cold compress, then it will stay down for a bit of a time. I think they always come back, and especially if it turns different colors. I saw this one guy. His was like black and blue at the tip of it. And if it gets like that, you immediately have to go to the doctor. Go back to your surgeon and get it fixed. But mine's only come out maybe about an inch at the most. They said use brown sugar. I tried the brown sugar and it went in for the night, but I was on my back. So, when you're laying down, it goes in automatically anyway. So... I don't really recommend it, but other people, they say it works for them, but the cold compresses work for me. And then what had happened was I was online too, and I was looking for stoma belts, and I found that the stoma belts are really expensive. And there's a couple different things you can do. You can even go and get a maternity belt, and a maternity belt is soft material, and you can put it directly on your skin, and it goes around twice, so you can cut a hole for the stoma. And then on top of the stoma, there's little cups of ice cream. You eat the ice cream, and then you put that over the stoma like that, and then you put the maternity belt. Or what I got like a girdle, and I put the girdle over the ice cream cup, and it holds it in place all day. And then if you have a bowel movement, you're going to feel it. You're going to feel the pressure, so you can go relieve yourself or clean out your bag or do whatever in private, and handle your business the way you normally do. I'm pretty fortunate because mine's temporary. I have a temporary stoma, so I got like 4 to 6 months of having to deal with it. And if you guys out there that just got through the surgery, your first couple weeks, I know it's really scary. Mine was huge. It was really big, but it does shrink, and you get used to touching it and cleaning it, and don't worry, you're gonna get it. You're gonna get it. You're gonna get used to it, and I just want to give that, end this on a positive note, because I was really scared when they first told me. I was thinking of people that are like in a wheelchair and totally paralyzed, and they can't really, take care of it the way that they would like. They have somebody else taking care of it that's probably not, as sensitive, to that person's needs, and it's kind of sad. I mean, because I always thought that if you have a stoma, people are going to know because they're going to smell it all the time, and it's not like that at all. As long as you keep it clean, and you have a fresh bag on, and if you smell it, there's something wrong. there's a hole in your bag, or there's a hole on the there's a hole on the wafer or something like that. There's something wrong where you have to change it immediately if you could smell it at all. And that's my first advice I'm giving right now. I've only had it, a little while, and I just want to give you rookies out there, some hope that, it's not as bad as you think. And that's it. I'm Bart. Comment on this video if you want to. I'd like to hear from anybody. And it's better for me to talk about it because I'm back in, for cancer, and it's a long road for me, but I'm gonna get better. It's all good. All right, later.